Alright folks, grab your mirrors and brace yourselves. These cosmetic fails will make you think twice before booking that discount filler appointment.
Hey everyone, look at my face. It's devastating, right?
Yes.
I want to inform everyone about the risk of a BBL broadband laser facial. I recently went in to see my esthetician and was told that this would be perfect for my skin.
Oh my god.
No risk, no scarring, no downtime. Just a little bit of swelling.
What happened?
Unfortunately, after my service, I went into shock. Had to be sent to the ER and now have first and second degree burns.
Oh my god, I'm so sorry.
This service is not for melanated skin, not for pigmented skin, and at this point, shouldn't even be offered to people with brown skin.
Oh my god.
Once again, please people, look at the risk. Don't allow them to tell you it's for our skin or that it won't leave scarring or that it's going to be okay. I had to go to the emergency room and my body went into shock. I could have died on the table over a facial. I am traumatized about this whole situation. And I pray that this gets out there to someone out there, that they check the...
This looks so painful.
Google it. Look up the risk. Get a second opinion. Do a test patch if you have to. But be aware that this is not for our skin. Yep. That's the facial I got. What is this, day 5, 4?
Oh my god. And she just wanted to get a facial and she trusted the professional. But this only shows that people make mistakes. People can not know a lot of things even though they claim to be professionals. And that you always have to do your own research and weigh the risks. I mean, she just wanted her skin to look beautiful, to rejuvenate her skin. I can't blame her, and she was told that that would be perfect for her skin, and look what happened. I hope she heals. I hope her skin heals and looks the way it did before, but oh my god, that looks so painful.
So, had this beauty thing done. This is not beautiful though. Didn't get a warning of what it was going to look like for a week or so before it all healed. And it is, needless to say, incredibly painful.
I can imagine.
So, my life, I will be hiding in my apartment for at least the next week. Next time, I will be sure to ask, what will I look like afterwards?
Right, you should always ask about the rehab period and what it would look like afterwards and the aftercare. But well, I don't know for sure, but from what I heard about this procedure is that it's gonna heal and it's gonna tighten your skin. So hopefully this is what's gonna happen to her skin.
This one, and these are the dangers of dermal fillers. I love dermal fillers. I inject them. Here's the precautionary tale of a woman whose nose, as she says, melts off after filler injection. She's 52, her husband is 10 years younger and got mistaken as her son on a couple of occasions, and she's been getting fillers over time. However, in the year 2000, she had a filler injection, her nose felt numb, and she had an occlusion. The filler goes into, around, or causes spasm of the vessel, and you get death of tissue. Now, someone commented here on my other channel, in fact, I think it was an injector, said, well, it's just an occlusion, no big deal.
It is a big deal.
It's a huge deal. You need time-sensitive intervention and you need the right products to dissolve. Sometimes you need an ultrasound to locate it properly. Some people getting fake fillers are getting permanent ones that cannot be dissolved and you cannot reverse these. See an expert, you get what you pay for. Filler injections are a big deal.
Oh my goodness, they absolutely are a big deal. Oh my gosh, her nose. I mean, I understand. She just wanted to look younger. We all fall for this these days, like with social media dictating us what we should look like and what cosmetic procedures we should get done in order to look younger, because this is the standard these days. But I mean, Jesus Christ, it's not worth it. Because the thing is, we will all get old. No matter what we do, we will all get old and we will all look older, our age. I mean, looking at this, I was scared of any kind of procedures, to be honest, because I've heard a lot of horror stories. But just looking at this, I think that I'd rather grow old like a raisin than lose my nose. But I feel so sorry for this woman. Jeez.
So I'm trying not to cry right now, but these are my lips. Not overlining and overshading, nothing. I went and got lip filler 3 days ago. Today's the 3rd day. And my lips are like perfect.
Notorious lip fillers.
But I have wrinkles in them, so I just want it not wrinkly anymore, you know? Okay.
What happened?
This is the
What
day I
happened,
go
girl?
in for my lips. You see how wrinkly they are? I only wanted half a syringe so they can get de-wrinkletized, you know, because I have really full lips. Like,
Okay.
this is
They
the
look
other
okay.
side, so you
Beautiful
can
lips.
get a whole day of. This is the other side,
Natural
okay?
lips, okay.
Yeah, okay.
Okay.
This is, for a whole syringe, it was $600, so I came with the $600 just in case. I felt like, you know, hey, let's do more of it.
$600.
I told her 2 weeks ago I wanted just the wrinkles done and a message just the
Come
wrinkles
on.
done.
Okay, okay. Show us
And
what
when
happened.
I got there, listen, I just want the wrinkles done. She started talking about lip shape. I'm not a professional, whatever, but I'm like, well, I have half a syringe or whatever, okay. But I'm like, I like my lip shape. I don't want to change it. She's like, well, I can make your Cupid's arrow, like, or whatever it's called, but more defined. I'm like, okay, that's fine, you know, whatnot. But, you know, I'm just like, hey, I just want the wrinkles, you know, fixed, do whatever. And she was like, yeah, you know, we can do that. And then from there, we can build on top. And then I'm like, yeah, cool.
All right.
But again, I'm just like, it should just be, you know, whatever. When she was doing it, I heard her say, oh, you know, you actually could use the other half a syringe. But if that's what you knew and thought, that's what you should have done. But I'm still confused because I only felt 2 pricks at the bottom and a lot of pricking at the top. And I'm like, okay, I know I have wrinkles on everywhere my lips.
Show
like,
us,
okay.
girl.
So now we're just going to go back to my lips with some lip stick on, basically.
Okay.
Here's my lips.
Okay.
Like, I've seen everybody else on YouTube. But they're, like, I don't know. I'm so worried. Like, why does it look so bumpy right there?
Maybe it'll get better.
Oh.
Oh no. I've seen videos where you're supposed to massage your lips for the filler to go into correct spots and places, but I think it definitely should not look like that for $600. Oh my gosh. And as far as I know, fillers don't dissolve and they can migrate. This does not look good. And with everything we know about fillers, like, just think about it. You are injecting some substance, some foreign substance into your face. And now we know that it does not dissolve and it migrates. And some people still do it. Some people that don't even need that. She didn't need that, for sure. I mean, I understand sometimes you have to get a plastic surgery because something happened to your face. You have gotten into a car accident and you need it. She didn't need that. And she paid $600 for that. Ugh.
Tell us what you had done.
I had fillers in my nose and Botox on the sides.
How many days ago?
Again with the fillers.
2 or 3 days ago.
Okay. So, not much cap refill over here. And we got a little cap refill.
I'm pretty sure it's not supposed to look like that.
The plan is going to be to put Hylenex. I'm going to follow up with you in 2 to 3 days. And I'm going to put you on antibiotics. Probably going to talk about hyperbaric chamber too. We're going to give you a nitro paste as well, and then follow up with you very closely. Deal?
Deal.
Filler in the nose. What was it supposed to do? Like make your nose straighter? You failed facelift. Where's her earlobe? It looks tight, and it doesn't look tight at the same time. The skin here at the bottom is loose, and here's everything is so tight. Ugh. That plastic surgeon should be sued. Okay.
This does not look good.
It does
but
not.
These types of lists do tend to look better as time goes on. And I bet that when all the swelling and everything settles down, she's gonna look just fine. But she's such a beautiful young woman. I don't understand what's the point.
How this happened, because presumably when you get cheek filler you're meant to look more sculpted, right? But she's just got what she calls a fat face. How do you go from wanting cheek filler and having cheek filler to, you see what she looks like after when it's dissolved?
The whole fatness thing comes from a lack of definition and volume. It can be because you've just injected too much. One of the things that causes a lot of issues with injectors is you know exactly where to inject to do a cheek treatment, but you don't know how to do that on the 1,000 different varieties of patients that you get. So it's quite common. You know that saying, when your only tool is a hammer, all your problems look like nails. It's a lot like that with injectors, is that you feel like I should be able to solve all these problems with injections, and you have to learn painfully that sometimes you can increase definition, but it's on someone with a big face anyway, and they end up just looking fatter or masculine is quite common. So patient selection is important. She's clearly not lacking in volume. It's going to be easier to over-treat her because she's not lacking in volume.
What I heard just now is that even professionals, they don't know how filler will act in your face and what you will look like for sure. They always tell you like, oh, this procedure is perfect for you. You will look so great. You need this and that and more here and less there. But they don't know for sure the outcome. They don't know what you will look like and the complications you'll get.
You learned that feels illegal to know.
That stuff like this is happening and it's completely illegal. The doctor that did this was not a board certified plastic surgeon, did this at a Botox party while girls were having drinks. He injected lips.
Botox party? What is Botox party?
Poor young girl's lips hit a blood vessel, caused massive swelling, could have ended up disastrous for this young girl. She could have necrosis of her lips. She ended up being okay. Lips turned out okay after time. The swelling went down after some dissolving agent was administered. So I do lip fillers all the time, but I actually do it in the comforts and
That
safety.
was not smart. Note to self. Don't take part in any Botox parties.
You're removed after about 3 days. Hopefully they don't leave scars. I just use TXA to reduce bleeding instead. What's going on with her eyes though? I don't know, not good. The sutures that you see all over her face are called a hemostatic net. And these are sutures placed to reduce the risk of bleeding after a facelift or a brow lift. They're typically removed after about 3 days. Hopefully they don't leave scars. I just use TXA to reduce bleeding instead. What's going on with her eyes though? I don't know, not good. The sutures that...
Oh my god, I hope that heals. Ooh.
Oh my gosh, what did her doctor do to her face? That scar is in a bizarre location for a brow lift. You can see how tight her eyelids are, and there's no eyebrows. They removed her eyebrows, for God's sake.
This does not look good. Where are her eyebrows? What the hell happened? Is it even legal to do something like that? Look at the scar. Is it gonna heal to the point that you won't be able to see it? Oh my gosh, this looks so uncomfortable. Why? I don't know the backstory. Maybe she didn't want her eyebrows anymore? What the?
Embarrassing, but I think my filler was botched. As you can see, this giant thing right here. Yeah. That is probably an infection.
Yeah.
Now the rest is just me being ugly,
like
like my breakouts, my dry lips, and then this is the normal bruising. I'm going to document what happens here and it's going to be ugly,
And
most
she did.
likely. I shouldn't say that. It's gonna be fine. But anyway, this is definitely an infection. So here goes my first Augmentin pill.
Oh my.
That was a giant pill. I don't blame them at all.
An infection from
When
the
it
filler
was the time for my appointment,
jaw.
I had a huge breakout right here. You can see where it was still healing, and there's always like a risk for infection, right? They did a great job on all my other injections. I've gotten Botox from them.
I'm sorry, I was talking. Did she say she wasn't blaming them? She didn't blame them?
I don't blame them at all. When it was the time for my appointment, I had a huge breakout right here. You can see where it was still healing, and there's always like a risk for infection, right? They did a great job on all my other injections.
I'm sorry, what do you mean you don't blame them? Weren't they the professionals? Weren't they supposed to know better and tell you, hey girl, you have a breakout here, so we shouldn't be doing this right now because there's a risk of infection and you do not want that. Maybe come back later. Weren't they supposed to say that? What do you mean you don't blame them? Like, you don't know.
Other filler from them, but this one is not looking too good. This was last Wednesday. I told them yesterday, which was Monday. As soon as I told them, they were like, we want to see you right away. We're going to prescribe something right away because they're worried. And I think that's all a good sign. Like they, weren't like, oh no, it's nothing. Like they were worried.
They should.
So I just picked it up. They wanted me to take it right away. They even tried to get it yesterday, but it was too late in the day.
Because it's not nothing.
So I'm going to take this Augmentin twice a day for the next 7 days, and hopefully
they know that it's something.
My face isn't too messed up. We'll see what happens.
I mean, I know anything can happen, and the aftercare is also very important, and what the person does to their face. However, she said it herself that she had a huge breakout, that it was painful. You could see it. So if that told her, and she knew that there was a risk of infection, the person who did the filler should have known better.
Okay, let's see the damage from the day. Had to make sure all the beauty filter was off. Ow. Ugh, everything's too noisy out here. I forgot to follow up, but it's bad
and painful.
No, it's actually much better. I just am tired of feeling ugly. But look at this, look at this. Is this gonna be really gross? Can you see? I don't know what that is, but it can't be good. Tomorrow, I have a follow-up with the provider.
Good.
Stay tuned.
Another update.
I want to pull this thing out so freaking bad, so I think I'm just gonna do it. The fact that I have an open wound in my face.
It says, pulling the dead worm out of my chimothy, my chin. I think she named her chin tumor Timothy. It is too, guys, it is too graphic. I just stopped the video. It's too graphic, so I don't think I can put this up on YouTube. But you can go to her TikTok and you can see everything. Okay, let's go. I am freaked out.
Freaking me out. Look at how
Terrified.
effing gross this is. I don't care how small it is. It's disgusting. So shall we? Shall we?
Oh my God.
Here we go. Here we go.
Oh my God. It's stuck. It's a maggot. It's not a worm.
I don't really know how long it is, and I know I'm not supposed to pull out a lot at one time. So maybe I should pull out the rest tomorrow. I'll give it one more try, and if I pull it 1 millimeter and it comes out, that's fine. And if it doesn't, I'll just wait.
In your chin?
I want to pull this thing out so.
What did I just see? There's a whole maggot in her chin. I'm literally shocked. How the hell does this even happen from getting a filler? Like, I mean, the instruments they were using clearly weren't sanitized. They weren't clean, because otherwise, how would that thing get there? There had to be an egg somewhere. An egg had to get into her chin with the injection, and then that maggot grew in her chin. I don't know for sure what happened. She didn't say anything, and I probably don't make sense, but I'm just so shocked. She's pulling it out. She's pulling it out. She's pulling it out.
That was it. That was it. I mean, it's...
She did it. It was small. Maybe that was just a part of it because it looked bigger before.
If you're just joining in, this is the wound that I pulled out an entire worm from. If you look at this comment, you'll understand what I mean. I have a whole series. It's way too long of a story, but here's the update. We're healing up okay. I went to the pool today. I did not get my face wet, but I shouldn't have done that. And tomorrow, no, 2 days from now, I have a follow-up because
you need to.
You see how that...
You need to get that taken care of, girl.
Yeah, that's not right.
That's not right. Oh, this is not right.
You. I know it's funny to you
It's
guys,
not.
but it's not.
It's not funny. Is it funny to you? It is not funny.
Oh my gosh, I'm actually just over caffeinated, but last night, you know how it was so swollen? See how it's a lot less swollen? Something came out. Actually, a lot came out.
More? A lot came out?
Oh my god. I honestly don't know if I can show this on TikTok. I am going to use this to raise money for what I should be raising money for. So if you need to be comforted because you are quivering at how disgusting this whole story is, I recommend this sweater.
Oh my god, what is that?
Ain't no way Timothy has a little sister. It's on the other side now. Oh my goodness, girl, I hope you're okay. This is horrible.
Oh my god! What is that?
I don't even know what to say. That's... wow. That's one hell of a story. I honestly was scared of any kind of procedures before, but now I am literally terrified. Literally terrified. Can you imagine having a maggot in your freaking face? In your freaking face. And all you wanted is just to be more beautiful. More beautiful. I'll tell you what, we shouldn't let mainstream dictate us what we should do to our faces and what we should look like at any age, I mean, how crazy is this? Girls in their 20s do so much to their faces in order to look younger when they in fact look young and they don't need all that. Okay, so we have our last video, our last story from this lovely lady for this video.
So I'm actually pretty miserable. I get Botox for migraines every 4 months, and it's been helping. And my neurologist, after 2 years, moved to another town, and so she put me up with.
Okay, and I assume that something went wrong just by looking at her face and her eye.
Somebody else. So I went on Friday and had my first session of Botox with him. And now my right eye will hardly open. If I really try hard, I can open it a little bit, but then everything's blurred and I see double vision. And he said 3 of his patients, this happened to him, and it was probably a bad batch. But everything I've researched said that it's not a bad batch. He just put it in the...
What do you mean it's probably a bad batch? Like, to 3 other people this happened to as well. It doesn't make it okay. It's still your responsibility. What is she supposed to do now?
Wrong place, and it was his error.
It was
and
his
now
error.
I'm stuck like this for possibly 3 months. And I'm miserable. I can't drive. Driving's miserable. So I'm gonna get a patch and hopefully that'll help.
I'm so sorry this
Wish me
happened to
luck.
her. Okay, we have an update.
I just wanted to give you an update. It's 5 weeks today since I had my Botox for migraines. As you can see, my eye is open. And so I'm doing a lot better as far as the way I look and how I feel that way. I still have double vision, and the double vision is just really annoying. It's really hard to drive, and I definitely cannot drive when it's dark, because I just can't see. But anyway, it's getting better, and it's taken 5 weeks to actually get to this point, so that gives me some hope. And just a word of caution again, always vet your injector. It doesn't matter if they're referred by a doctor, if they're a medical doctor themselves, as in was mine.
She's totally right. Yeah, I'm so sorry that this happened to her. I mean, and she didn't even get Botox to look younger. She got it for her migraines, and I know that a lot of people suffer from migraines, and it's who suffer from migraines. It's absolutely awful, and I believe that the Botox gets injected into your head. I've had migraines a couple of times in my life, and they are absolutely miserable. But yeah, as you can see, there's always risks. All right, guys, thanks for watching this video. Always think twice before doing something to your face, and stay safe out there. Love you, and I'll see you in the next one.